My name is Renee Bowden, and I'm going to be doing my internal feeding video today. First, I'm going to identify my patient using two identifiers, and I'm also going to ask my patient if they're experiencing any nausea or vomiting today. And my patient says he or she is not, so I'm going to go ahead and wash my hands and apply clean gloves.
Yeah, that one has no mannequin.
At this time, I know my patient can tolerate lying flat, so I'm going to go ahead and do so. I've already gathered all of my supplies. I'm going to measure from the nares to the bifurcation, sorry. We're at 80 centimeters, which is, I've already confirmed it to be the same as the last. It confirms all the orders are right, and I've also confirmed that the chest x-ray was performed. So the tube is placed correctly in the stomach. I'm going to now inspect my patient's abdomen. By doing that, I'm going to just expose the abdomen, trying to keep privacy. I am inspecting the abdomen, not finding any abnormalities, and I'm going to auscultate the abdomen, starting in the lower right quadrant, listening for a full minute for at least 5 to 35 gurgles. Okay, now I'm going to palpate the abdomen. And I will percuss as well. Everything appears to be within normal findings at this time. I'm going to go ahead and cover my patient back up. I have placed a dry chuck under where I will be working. And I'm going to place the head of the bed at least 30 to 45 degrees before starting the feeding. At this time, I'm going to check the stomach contents pH. So I would clamp the tube and withdraw about 5 or 10, just a small amount of stomach contents, 5 or 10 mLs. I'm checking for color and consistency. The color should be a nice grassy green color, and the stomach pH should be under 5, which it is. So at this time, I'm going to take the residual of the stomach contents out. And we're looking for the stomach residual to be under 250 mLs, which it appears to be under 250 mL. So I'm going to go ahead and gather the residual and put it back in. If I raise the tube, the flow will go faster. If I lower the tube, the flow will go a little slower, but always remembering to keep it above the stomach. I'm going to go ahead and put the rest of the residual back into the stomach. At this time, I'm checking the expiration date of the normal saline, and I do not have to lip it because it's a brand new bottle. So at this time, I'm going to just flush with about 15 to 30 cc's. And at this time, I'm going to go ahead and check the expiration date on the feeding, also checking to make sure it's the proper feeding. I'm gonna shake it. I'm going to use an alcohol swab to clean the top of it. I'm gonna open it. And whatever the prescribed amount by the doctor is what I will be giving the patient. And I would put a little in at a time, making sure my patient can tolerate the flow. And when it gets to about 3/4 of the way empty, we're gonna go ahead and put more in until the required amount of feeding is all done. And I would clamp. I would flush again. After the feeding, I would go ahead and flush another 30 mLs. Then I would clamp, remove my syringe, cap the tube, and get rid of all of my garbage, if you would. And then I would be sure to maintain the head of the bed at least 30 to 45 degrees for at least a good hour, and then I would reassess my patient to make sure they're comfortable and good. That is my video.